Hong Kong can beat COVID. In order for Hong Kong to recover economically and enhance its quality of life, it must defeat the COVID-19 virus. Both zero COVID and living with COVID pandemic management techniques throughout the globe are now in use and incur substantial costs in terms of both human lives and financial resources. On the basis of a study of coronavirus data in various nations and areas, I'd like to discuss the advantages of the zero COVID strategy. The government doesn't have to do anything under the living with COVID policy, save from a push for vaccination, mask regulations, and social isolation. Even if the herd immunity threshold is not met, it may remain inactive and wait for it. It has been adopted by the United States and Denmark the most. COVID-19 fatalities per capita in Denmark range from 700 to 700 per million persons, with roughly 40% of the population afflicted. COVID-19 mortality per capita in the United States have reached over 3,000 for every 1 million persons infected with the virus. Both Denmark and America have lower infection rates, but their mortality rates are greater due to a large income and wealth divide in a society plagued by the uneven allocation of healthcare resources. It's hard to see Hong Kong going this route. Coronavirus infection might spread to as many as 1.8 to 3 million people, and the number of people killed could grow to as many as 5,000 to 20,000. In comparison to Denmark and the United States, Hong Kong has a lower vaccination rate and a denser population, making it more vulnerable to the virus's rapid spread. To add insult to injury, its illnesses and fatalities per capita may even outpace those of the United States. Neither Hong Kong, nor anybody else, should tolerate it. Of course, adopting a zero-COVID plan entails sacrifices on both the financial and social fronts. We Chinese, on the other hand, adhere to a different set of ideals than do our Western counterparts. In our view, the lives of all Hong Kong residents are priceless and should not be taken for granted. So we can't only preach human rights while failing to save lives, as shown in the UK and the US. Coronavirus fatalities may be prevented by implementing a zero-COVID rule. The mainland is a good example of this. Additionally, the pandemic is a test of Hong Kong's government's competence and flexibility. It can learn a lot from the mainland when it comes to implementing the zero-COVID policy. The federal government will also completely back it. Because of the acute scarcity of beds, it may be necessary for the Hong Kong government to consider temporarily permitting mainland medical professionals to work in Hong Kong's mobile hospitals, which might be staffed by volunteers from the mainland. As in unique administrative territory, it is essential for everyone to consider the larger interests of the region, remain confident, eliminate biases, and work together. For the benefit of Hong Kong's citizens, we can defeat the virus if we put in the effort in the pandemic response. 8.1% growth in 2021 and a 5 to 6% increase this year are predicted for the national economy. There was a 6.4% rise in Hong Kong's economy in 2021, making it one of the strongest economies in the world. We can have a more steady and stronger recovery in 2022 if we can manage the infection quickly.